Great. I think it's 9:02, so we'll get started. Maybe show you if I can ask you to take over letting people in, admitting people, that would be great. So just also want to let folks know that we are recording this meeting. We had a number of folks who said that they would like to see recordings, but weren't able to make the meeting. So we'll chop out any sort of like discussion and then things that people just focusing mostly on the presentations, but just wanted to let folks know about that. So with that said, let's move on with our team meeting. So just get this going. Great. So I'm just checking you can still see my screen. It's good. Okay. So I'm calling today from the traditional unceded territory of the Musqueam Indian Nation out here on the campus of the University of British Columbia. And just really grateful to acknowledge as well the broader territory of the Coast Salish peoples where I live and work. I know many folks on this call do as well. And that includes the traditional and unceded territories of the Musqueam, Squamish, and the Tsleil-Waututh nations. I'm very grateful for their guardianship of these lands and the privilege it is to be here today. And encourage folks, if you'd like to enter a land acknowledgement from where you're calling from, feel free to do so in the chat. So I just want to start out first with, it's been a real privilege actually the last couple of days, just looking back over all the work that's happened and everything that's been done through this team grant. And so just wanted first to extend my sincere thanks. Thank you, Sarah, adding about the Two-Spirit program celebration of two. I did see that at the Birdhouse, which sounds like a great event. So just first I wanted to take a moment as sort of the nominated principal applicant for this team to really thank the contribution of everyone who's been part of the executive of this team currently and in the past since we started back in 2018. And I think also then just on behalf of the executive team, just really want to extend a really warm thanks and appreciation to everyone on the call and everyone who's been part of the work of this team and supported the work of this team grant over the last 6 years, because we couldn't have done this without you all, and just wanted to start out by that really grateful acknowledgement on behalf of all of us. Oh, I need to watch my time. Okay, so let's go over the purpose for today. So really it's the end of our team grant, or at least it's the end of the funding for our team grant. I know there's still some ongoing work that's happening and new initiatives and collaborations that formed as a result of this grant. So, but this is sort of wrapping up the funding that we have for the grant. It's also been a while since we had a full team meeting, and so it's a chance to kind of share some recent and key findings across our 4 research goals. In addition to that, we'll start by reflecting on some of the impacts that we've had, and then end today by sharing some of the research directions that have sort of emerged from our team grant and where we're going from here. So the meeting agenda was circulated by email, and it's a fairly packed agenda, but just to note that at 10 o'clock we will have a break. And then, we'll be spending time hearing different presentations from folks speaking to different aspects of our research goals. And we'll aim for an end at 11 o'clock. So because this is even though we built in some discussion and Q&A time, it may not be enough. And also just want to encourage folks to liberally use the chat function. If there's this is much of what I'm presenting at the beginning is sort of my perspective on things. If there's perspectives you'd like to share, if you have any questions or comments or just reflections going through the presentation today, please put them in the chat if it's outside of the time we have allocated. And all the speakers today, I think, will be able to sort of respond to specific questions that you might have around their presentations in the chat as well. So as we know, the focus of the team grant is Get Checked Online, and not going to take time to explain the program model today, because I think most people here are very familiar with it, or at least familiar enough to know kind of the gist of how the model works. But that's really the focus of this grant and was sort of the real heart of this grant when we applied for it. So this is a picture from 2018, which was our first study team meeting of everybody on the team grant, where we brought everyone together in Vancouver for this great 2-day workshop to kind of kick off the grant. And there's a lot of familiar faces still of people who are still involved in the grant, as well as, some folks who, we also have a whole bunch of new folks that are part of our grant as well. And so just want to take a moment to acknowledge that, but just to also it's good to reflect back on that time. And so I went back through all the meeting notes we've had and presentations from previous team meetings, and just thought I'd refresh our memory a little bit around some aspects of the grant, and then think a bit about some of the impacts. So this is a team grant which was around GetCheckedOnline, and we had goals that were related to our work as a team, and they were to establish a highly effective, well-governed, integrated team that meaningfully engages communities, to use implementation science to understand the contextual factors that affect implementation and program outcomes during the scale-up of GetCheckedOnline, and to produce findings which really maximize the impact of GetCheckedOnline on increasing diagnosis of sexually transmitted bloodborne infections and linkage to care. And I think from this team goal perspective, I think that we've done very well at sort of accomplishing these three goals that we had as a team. So we have 4 research goals for our team grant, and these were to understand what works and for whom it works during the scale-up of GetCheckedOnline in British Columbia. Our second research goal was to assess the feasibility of implementing GetCheckedOnline in a different healthcare system, which is the work of our colleagues in Ontario, we'll be hearing from later in the meeting. Third is research to help adapt the intervention so it has a better impact. And finally, to describe the institutional context, processes, and service inequities for GetCheckedOnline users. So we've done work across all of these 4 goals, and I think have made a lot of, produced a lot of like really relevant evidence, and have had some really impactful work related to all of these goals. And I'll talk a little bit about those. And actually the presentations that we'll have today, which speak to some of the more recent findings or key findings, really actually align quite well with these goals, and sort of reflect all of these 4 goals that we had in our team grant. So at the beginning of the grant, in our team grant, we used this photo to just really acknowledge when we started that the paths ahead were not totally clear, right? So we know that implementation science and is really dependent on many things, and the whole piece of it is also recognizing that there are things in the context of the environment that can really affect how a program is implemented. And so I just wanted to acknowledge that, we had originally intended, we had a whole number of grants that we intended, and we did very well at sort of, about 2/3 of those originally proposed grants have been completed or are either in progress. But we've had other factors that have come up that sort of like we followed through our team grant. So first has been following the pace of implementation of GetCheckedOnline. So 6 years ago, we couldn't really predict how GetCheckedOnline was going to expand. And so we've been, so our research has really been following that pace of implementation. COVID-19 was obviously a huge factor that affected, that did affect some of the realities of the work that we did around research. As well as sort of identify new priorities. We've had changing fiscal realities. Well, we've known, if you were there in the team grant in 2018, we were talking about the importance of thinking about funding and sustainability, and really being mindful to that during implementation. And that's become an even greater pressure over time. And so some of these changing fiscal realities, particularly, in the past year with some of the cost constraints within the BC healthcare system, is a change that we've also been rolling with. Another is that I think, at least is speaking for myself and the team based at BCCDC, there's been a much greater focus on reconciliation in our work, as well as testing in rural, remote, and Indigenous communities. And that's been another factor that sort of shifted the direction of our work. And finally, feasibility. We just found that some of the things we proposed weren't actually feasible to do, or we lacked some other resources, or weren't able to get the right people to do the work. So these are all the factors that sort of helped direct kind of the work and where we went. I think the other important thing is that this also created a number of new opportunities for us in the team. So we were able, for example, with the COVID pandemic, to shift and look at a bit more about the role of GetCheckedOnline during the pandemic and how that related to people's unmet sexual health needs. We've had a greater focus now on thinking about sustainability and integration of GetCheckedOnline as a result of some of these changing fiscal pressures. Other things have come up, like MPOX, where we've been able to quickly tool our research platform to do a study on MPOX vaccine uptake. And I think now focusing more on things like self-collection because of their relevance to rural and remote Indigenous communities. So I think that's we've been able to really accomplish a lot, and I think to really roll with where things are going in the pace of implementation, which is what we'd anticipated would need to happen. Okay, so I'm just going to quickly go through some of our impacts. This was actually a slide from the first team grant where we celebrated coming together as a team, and I think it's relevant today as we're sort of wrapping up our team. First, just acknowledging, I think we've been very successful in sort of that idea of integrated knowledge translation, of working very closely with folks in community, labs, public health, government, to differing degrees between BC and Ontario. And that's been a really, I think, successful accomplishment in our work. And that's also led to us having stronger relationships with greater involvement and support from leaders and decision makers. In fact, our team was just, in reflecting on this presentation, realized that back in 2018, we had one person from the lab that was sort of part of our team at that time. And now working very closely with the lab, folks in government is like very much part of the work that we're doing and part of our implementation science research. And that I think has been a big accomplishment. The findings that have come from our research have strengthened the case for sustaining and expanding GetCheckedOnline in British Columbia. It's been used as a rationale for adding new sites or for health authorities to be advocating for funding for expansion of GetCheckedOnline. And it's been incorporated into funding proposals. Many of you have heard us talk over time about business cases, and this is sort of one of the things where the evidence has been quite helpful in terms of helping to make the case for continuing to expand GetCheckedOnline. And just to note that we recently tried to summarize a lot of this evidence around the impacts of GetCheckedOnline in a report that's available on our DISHI website, or I'm happy to share it directly. Just reach out. So a couple of other impacts. So first, I think the implementation impact. So findings from our research have led directly to adaptations of GetCheckedOnline to improve equity in the user experience. And I think some of the work that we will talk about later is related to this. And we've had findings that have either suggested or confirmed some of our future directions for the program. For example, looking at acceptability of self-collection kits as a supporting of that as a direction for us. I'd also really like to acknowledge that we've had some really amazing trainees and folks sort of earlier in their research career working with us over the course of this grant, who have all been awesome and exceptional, and I think have really contributed greatly to the success of our team. And just really grateful for their contributions and having that chance to support them in their research careers. And finally, just from a scientific knowledge translation perspective, or end of grant knowledge translation, if you like, I think we've done pretty well. There have been 23 peer-reviewed publications, and there are a couple of more still in the works. We've contributed to 2 book chapters. There have been quite a number of conference presentations, including a number of invited presentations to present at different conferences, and a number of technical reports. And as I mentioned, there's still more in progress and some more that will be coming related to our grant. Just also mention that we've had the chance to build collaborations and connections to other provinces in Canada, where there have been discussions about the role of GetCheckedOnline kind of within their regions, as well as connections internationally in the US, the UK, and Australia. And with that, I will end, and we can all give ourselves a big pat on the back, because I feel that there's been some really great things accomplished through this team grant.